team, Jean Sinodinas, as well as our former DCH awardees, Chelsea Bennett, Melissa Martin, and Kate Holmes from the Louisiana Department of Health and Hospitals. And our focus today, as you know, is on communicating data. So from baseline data to outcome data, you are collecting this incredibly important information that needs to be shared with your partners and your wider community. So in today's session, you will understand why it's important to connect your data to your messages and stories, learn how social math can be used to present data to many audiences, both visually and verbally or linguistically, and explore methods for integrating social math into messages and materials. As always on our webinars, we're going to share some resources and announcements towards the latter part of our event today. And with that, I'm going to turn it over to my colleague, Jean Sinodinas, who's going to take us through today's first learning session. Jean?
Thank you, Patrick. You know, numbers are powerful. They help us define and explain the world in ways that words alone can't. Numbers really have stories to tell, and it's our job as communicators to convey those stories so that audiences understand them and are even moved by them. And we truly hope that this training does exactly that. But first, let's consider how data can be used in our messages, and let's use hypertension as an example. Data can describe how bad a situation is in order to raise or maintain awareness of a problem. For instance, about 1 in 3 adults have high blood pressure, but only half of those, 52%, have that blood pressure under control. Data can also offer a solution for a problem and predict success. In other words, reducing the average sodium intake across the population to 1,500 milligrams per day may save 26 billion healthcare dollars and reduce cases of hypertension by 16 million. They can also report that success through outcome evaluation data. For instance, over half of the participants in our program had their blood pressure under control for the first time in years. All 3 of these examples paint a picture. They tell a beginning, a middle, and an end to a story. In other words, you don't need to wait for your outcome data to start talking about it. Let your existing data help you tell your story right now. But understand that your audiences will need help in understanding your data, and that's for 2 key reasons. First, not everyone understands health information. They have what we call limited levels of health literacy, which is the ability to obtain, communicate, process, and understand basic health information and services to make appropriate health decisions. Now, health literacy matters to people who need information about their health, from information to services so they can make informed choices. And as you can see, however, only a small number of U.S. adults have proficient health literacy levels. Now, in no way is health literacy connected to education. We are, however, reminded that our messages need to be clear and they need to be free of jargon. Another challenge that we face in communicating data is that not everyone understands numbers, and that's otherwise known as numeracy skills. A 2013 study from the U.S. Department of Education and the Program for International Assessment of Adult Competencies measured numeracy skills in countries across the world. And here in the U.S., they found that only 9% of adults, only 9%, were found to have high numeracy skills. So in other words, communicating data so that our audiences truly understand it is a challenge. And it's important to note again that low levels of proficiency in numeracy has nothing to do with intelligence, but it has a great deal to do with how we process information. Research in adult learning suggests that approximately 65% of the population prefers to learn new information visually, at least in part, if not in whole. And some studies suggest that this number might actually be as high as 85%. So when we think of sharing data visually, we still tend to think of standard tables and graphs and charts, the kind of thing you see pictured here on the left. Ironically, though, this kind of representation is often part of the problem, not part of the solution. Yes, visual representations of data are important, and some of your audiences are going to be quite comfortable with the bar charts and line graphs you see pictured here, but bear in mind, the majority of us really do struggle to make sense of what this kind of representation means and why the data matter. And that's because data represented this way, frequently lacks a context that makes it easy for us to understand them. So creating a meaningful context for data is at the core of this learning session. And we can provide that context by connecting our data to the human story of our work. Now when we effectively link our data to our stories, what we're doing is we're appealing to both hearts and minds. And we're providing that context so that our audience will understand exactly how important an issue is. So think about all of you, all of us today, all of us involved in making communities healthier. We can see this line chart, and we can quickly tell that there's been an increase in obesity among U.S. adults within the past decade. And because we have the backgrounds that we do, we have a built-in context for this work that makes sense. These numbers are easy for us to comprehend. We, in fact, can see the story that's inherent in this data. But now consider the many audiences that you need to reach who don't have our background, don't have our context, and aren't data savvy. They have those limited numeracy skills. And remember, that's most people. If we're lucky, we're going to look at a table, at a graph like this and say, so obesity looks like it's gone up about 6 percentage points in the last decade. Is that really bad? I'm not sure. 6 points doesn't seem like a large number. Should I care about this? I don't know. And does this matter to me? I'm not sure that I could say. On its own, data like this leaves our audiences with an abstraction that cannot move them to take any action. But we can improve the chances that our stories and that our numbers will be understood when we link them to our stories. And that's because stories have connected individuals and communities and cultures and generations for thousands of years. They're one of the oldest forms of human communication. I think of it as the original social media. Stories provide our audiences with a context, a framework for understanding an issue. So they can take an abstract idea, like the increase in obesity rates over the past decade among U.S. adults, and they can make it relevant. They can make the case that our weight matters. And it matters not just because it's tied to our health, but because it's tied to our ability to enjoy life fully. And that idea is not only relevant to audiences, it's deeply personal. Now, while stories may compel an audience member to say, I want to do something about this problem, stories alone may not be enough to prompt action. Audiences may need to know why a problem exists or how big the problem is. They also need to be pointed towards a solution. And all of those needs are met by your data. Data adds credibility to your story. Data provides the clarity and drive decisions that your stories need. So now to put all of this together again, linking data to the human story of our work allows us to move both hearts and minds. Now, of course, when we think of stories, we traditionally think of a narrative. It includes a beginning, a middle, and an end. But that's not the only way to tell a story with data, however. We can distill our stories and connect them to data through a technique called social math. And that's the focus of our work today. Social math is a tool that, when used well, can make just about any audience sit up and take notice. It conveys information by providing that understandable context that helps audiences immediately get the story inherent in the data. So let's look at an example. In the United States, food typically travels 1,500 miles from farms to plates, the distance between Phoenix and Chicago. It loses nutritional value, wastes energy, and weakens the economic strength of local family farms. So this is social math, and how does it work? It works by connecting two or more things together. It provides a comparison that audiences can easily process. In this case, we're comparing a distance, 1,500 miles, which feels a little abstract. And we're comparing it to the distance between Phoenix and Chicago, which is actually much easier for most audiences to grasp. Adding the visual image of a truck on the highway helps us see inside that long haul as well. So let's take a look at some other examples of social math. The tobacco industry spends more money promoting smoking in a week than the federal government spends on preventing smoking in a year. So again, you can see that we're making a comparison. In this case, it's about the amount of money spent between tobacco and the government. Now notice that we don't actually need the dollar figure here to understand the equation. In fact, this equation sets up an extreme comparison by using length of time, a week versus a year. Let's look at another example. In 1969, for many students, walking to school was as easy as walking down the street because their school was right in their neighborhood. By 2001, lots of schools were farther away from their students, and walking or biking to school was the equivalent of doing a 5K race or more twice a day. So did you walk to school when you were growing up? I did not, but I knew many of my classmates who did. And it's something we really don't see it very often anymore. And this social math equation helps us understand why by comparing that distance to a 5K race. Now that comparison anchors data to a reference that audiences understand. It makes the numbers crystal clear, and it makes the issue urgent and relevant. So of course, the key to any strong social math equation is to make sure that the context works for your audience. So we want to think about ways that we can compare data to dramatic events. For instance, the number of people displaced following a natural disaster. Understandable costs. For instance, our program costs less than a cup of coffee a day. Or current numbers from other issues. For instance, it's more than 1/3 of what we spend on prescription medication each year. Now, in the examples that we've looked at, we've been linking language with an image on the slides. So you can use them together. Very potent that way because they provide a deeper context for our audience. But language can stand alone as well. You can embed a social math equation into your talking points and messages for media interviews, for instance. And we're going to look closely at ways to share social math in your messages later in this webinar. What are the steps, then, to creating a social math equation? Well, first, we want to identify a key data point that you want to share with your audience. Now, if that data point exists as a percentage of something, it needs to be converted to a hard number. And that's the key to social math. We work in numbers, not percentages. Next, we need to find comparative data that's going to make sense and provide that meaningful context to your audience. So as you look for that comparative data, think about who or what does it impact? How much money does it represent? How much time does it represent? What resources does it use or save? How big is it? How long is it? How wide, short, or tall is it? And how might it be compared with a place or an event? And then finally, once you have all of this, again in numbers, not percentages, you can create your equation. Now there is a fifth step to creating good social math equations. We want to test with a sample from your intended audiences. We always urge you to test your messages and materials before you launch them into the world. It's part of the strategic communication planning process. So ask a segment of your intended audience, do they understand your social math equation? Do they understand it within the context of your larger message and story? So for instance, if local businesses may care most about return on investment, also known as ROI, and your social math equation may need to demonstrate then the cost burden of tobacco or obesity on the community, including costs for workplace absenteeism or health insurance, and use that comparative data to demonstrate return on investment. Schools, while they may need clarification on how safer routes to school can be linked to positive school environments, which can in turn improve academic outcomes and reduce absenteeism. And single parents who are struggling to make ends meet, they may need a comparative social math equation that demonstrates how affordable and easy it is to make healthy choices. So it's easy to test your social math. Simply show it to a member of your intended audience. You might even share it with a coworker, a family member, a friend. Does your audience understand it? Does it make sense to them? And maybe would a different comparison make your equation even clearer? Creating social math, it might be a new skill for you, but you really can do this. We had the pleasure of conducting a social math training for a previous DCH awardee, Transform Wisconsin. And as an exercise, participants looked at Participants looked at their local county data around adult obesity rates and the associated costs with that. And they were asked to create social math equations around those costs that were county specific. So here are just a few of the equations they created in less than 15 minutes using their laptops and their smartphones to research comparative data. And I'm just going to read them to you. The money spent on medical costs each year to address obesity in Marathon County, Wisconsin, could purchase a gym membership for every resident for 18 months. One resident of Monroe County, Wisconsin, making minimum wage would have to work 11 years to equal the annual medical costs of obesity in our county. For about the same cost as annual obesity-related expenses in Rock County, Wisconsin, we could fund a four-year public university education for every high school graduate. The annual health care costs related to obesity in Dane County, Wisconsin could buy every resident a bicycle and a helmet. Now it's your turn. We're going to pick up on a similar exercise to where Transform Wisconsin left off. Now, while those examples I just read came from their work in a training looking at their local data, we can approximate the experience with a sample community and sample data. Now, if you have a calculator near you or on your phone, you might want to pull it out for this exercise, or just jot down a little math on a piece of scratch paper with a pen. In this example, we're going to start with some sample local data. It's on the green side on the left. Let me read it. If 32% of adults 18 to 65 in your community are obese, and the total number of adults 18 to 65 in your community is 76,223, then the estimated total number of obese adults 18 to 65 in your community is 24,391. And 82% of that obese population are currently in your workforce. Okay, so that's data that you might have, a sample of data that you might have at your disposal, and you'd like to find a way to convey it using social math. Well, again, you're going to need that comparative data. So on the right side of your screen, we've provided some sample comparative data that may or may not be appropriate for a social math equation. Part of this exercise is helping you determine what does and doesn't work for social math. So we're going to give you a few minutes to try your hand at creating a social math equation. We would like you to take the hard numbers from the left side of your screen. In this case, that's the total population of obese adults, or the total number of obese adults in the workforce. And we'd like you to find a relevant comparison from the right side of your screen. And when you come up with an equation, please go ahead and use the chat function on the lower left-hand corner of your screen to share it. If you've got any questions about this exercise, please feel free to type them right in. I'll address them right away. And please remember that you always want your equation to be meaningful to an audience, but for the purposes of this particular exercise, just focus on creating any kind of social math equation using hard numbers on your left compared to something on the right. We're going to give you a few minutes to do this. Go ahead and have fun with this. Again, feel free to chat in any questions. Again, what we're going to do here is ask you to take either the hard number of total obese adults in your community, the 24,391, and make social math with that, or the 20,001 obese adults in this community who are in the workforce. That writes in the number of obese adults currently in the workforce would fill up the local rodeo arena 3 times. That's excellent. Is the money example an annual cost? No, it's a daily cost, $2 a day to serve one person 5 servings of fruits and vegetables. Oh, but maybe you're looking at the second one. The associated cost to employers for the lower productivity reaching, yes, it's $506 a year. Thank you. Good question. It's an annual cost. So Jeff writes, it would cost $1.2 million to provide obese adults in the workforce with 5 servings of fruits and vegetables for a month. $1.2 million to provide obese adults in the workforce for 1 month. Good. Okay, we'll talk about all these examples. This is great. Do we have any other examples? We're going to keep this open for just another couple of minutes. And let's see, who asked me about the annual cost? So Julie, your question about the annual cost, yes. I'm curious to know if anybody can come up with an example around lower productivity, that $506. Obesity costs local employers over $10 million a year in lost productivity. Yes, exactly. You guys are now getting the hang of it. This is excellent. Excellent. So the equations that you've come up with are right on the money. And I think I want to just acknowledge some real congratulations for reading our minds as well. Beth, take a look. There it is. The number of obese adults in our community could fill every seat in the county rodeo more than 3 times over. Excellent. And all we've done here is take the exact same equation that you came up with and put a picture with it. Now, we also used the figure around, we used the figure, the $10 million lost to employers, and then we also used the $2 a day. So this involved a bit more math than the others because we used 2 points of comparative data that really pull in several of your ideas into one equation. So we started by identifying that those employer-related costs of obesity. We took that working population, multiplied it by $506, and that gave us the $10.1 million. But we wondered what that money would buy, and that's when we took the $2 daily cost of fresh fruits and vegetables. And that gave us a daily cost to provide fresh fruits to this adult population. It came to a little over $150,000 a day. And when we divided $150,000 into 10.1, we figured that it would take 66 days, a little over 2 months, to purchase fresh fruits and vegetables for that population of adults 18 to 65. Now, comparative data. You're wondering how you can get it. We actually have several data sources listed in the resources section of our webinar. You're going to be able to use them to craft your own social map equations. So here we've just done a quick overview, explanation of what social map is and how you can create it. But I want to stop right now and turn it back over to my colleague, Patrick, to lead us through the rest of this webinar, keep us moving.
Excellent. Thanks very much, Jean. That was fascinating. All of you will have an opportunity to ask Jean and all of our presenters a bit later in the webinar. But of course, as I mentioned at the top, if you have any questions and are thinking of them right now, just put them in the chat feature in the bottom left-hand corner of your screen. So for our next section of the webinar, I'd like to introduce our team from the Louisiana Department of Health and Hospitals, Chelsea Bennett, Melissa Martin, and Kate Holmes. And they're going to share with us how they regularly use social maps to convey data more effectively with their target audiences. So, Louisiana, I turn it over to you.
Thank you, Patrick. Hey, like Patrick said, we're with the Department of Health and Hospitals Office of Public Health in the state of Louisiana. And today our goal is to walk through some how-tos that Louisiana did when creating social maps for our health promotion team. So we're going to talk about why we use social math, when it's appropriate to use social math, how we've created some sample equations, how we identify references and data sources that we use in our social math equations, and also highlight how we've integrated social math into our messaging.
Great, thanks, Melissa. I'm Chelsea Bennett with the Department of Health and Hospitals, and I just want to tell you guys a little bit to get started about what we do. So you can see here our mission, vision, and values, and I'll let you guys just take a look at that. But basically, accomplishing our program goals really relies on working with a lot of non-traditional partners. And what we've come to find is that this audience really needs a different way to interpret our info in a way that resonates with them and what they're doing. We take a big focus on collective impact and community level work, so it's essential to us to really get through to these people. It's really not enough for us to say that there's an obesity problem, you need to eat your vegetables, you need to move more. We have to find a better way to get across to them. So just to talk to you guys a little bit about why we sort of needed social math so desperately. In April of last year, we launched a big statewide health promotion initiative called Well Ahead Louisiana. And this initiative really focused on partnerships with non-traditional partners and sort of getting more into that space and that sort of effect for our residents. So this launch required a ton of talking points for a new audience that we really weren't used to getting through to. We had a lot of requests for interviews that were coming in, a new focus on e-cigarettes and tobacco prevention, just a lot of things that we hadn't necessarily touched on before. So that audience and the audience that we've used social math with sort of included some of the audiences listed here. Louisiana's population is very diverse. There's a lot of different economic backgrounds, a lot of different education levels. Like I said before, we're working with those non-traditional partners to help all the time. And we do a lot of larger presentations to mixed audiences that might not necessarily be used to what we're talking about or have ever heard about our work before. So when we started working with social math, we really found that we needed a process to sort of get it into all of our work. To get there, we identified a few key topics and brainstormed about how to make this data relevant to an average person and the people that we work with. We knew that in all of the different ways and all the different audiences that we were talking to, we needed a consistent message. So we decided to create a cheat sheet that allowed a quick reference when we were taking an interview request or if we had a request for talking points come up. We sort of found in this process which equations were really resonating with people and which ones weren't. So making the data relevant and visual was really important to us. And our streamlining really came from creating a cheat sheet with all of these equations and our sources where we pulled all of them together.
Thanks, Chelsea. This is Kate Holmes, and so at this point, I'm going to actually walk us through the steps of how we create social math here in Louisiana. Jane did a really good job kind of setting this up, but this is kind of the steps that we do whenever we're creating social math. So first and foremost, we choose a topic that really speaks to our work. So for me, I work in schools around physical activity and nutrition. So obesity is a really good fit. It's something I talk about all the time, and so it's good if I have some go-to facts and some go-to social math on hand. From there, you want to identify data sources, and this can come from a ton of different places. I use census data, county health rankings, any of our state-level surveys, but also I use basically anything that shows up in my inbox. I feel like I'm on a ton of different listservs, and they all come with so many articles, every day. And so if I see something that's really interesting, I try to use it. Just be sure that you kind of keep track of those citations and sources so you can quote them back if people ask for them. From there, you'll need to figure out some really some meaningful references. So look up the population of your state's biggest cities, or find out how many people can fit into a sports stadium. Figure out distances from one place to another. Make a list of those go-to references that have meaning for your community. And then once you have all that together, it's time to do the math. Create those social math equations. And then once you've developed those equations, combine all that information into one place so that you have a cheat sheet that you can always refer back to. So at this point, I wanted to give you all an example of how social math evolves. So this example you see is our first attempt at creating a social math equation. It was meant to capture the amount of money saved by reducing obesity rates. And we created this equation and then sent it back to SHI 360 for comments. And this is what they sent back to us. First, you can see that when you're sharing your social math equation, you don't necessarily have to share the data source with your audience. It's important to know where the data comes from and that you're getting it from a trusted source, but it's not necessarily a key part of the equation that you're communicating. Second of all, you need to tailor your equation to your audience. So even though, and you can see that one with the gym membership line, even though you or I may place value on a gym membership, your audience might be a rural community member who lives 50 miles away from the closest gym, and that just doesn't really resonate with them. So this comment really challenges you to think critically about who your audience is. And then the last piece, adding the 600,000 Louisiana students, that really took the equation a step back, because we're asking the audience again to continue visualizing what does 600,000 students look like, and that's the whole point of social math. We can't visualize that right away. So this next slide shows what we ended up with. So you can see we took away the source data. We just started with the money Louisiana could save by reducing obesity could, ... We also translated 600,000 into something easily understood. We discovered it was approximately the number of students currently in Louisiana's school system. And then that last piece, if you are talking to an audience that puts values on gym memberships, then you could include that in there, but really be thinking about your audience. So at this point, I'm going to lead you all through two social math examples and how we got there. So here's one of our examples. If Louisiana reduced the average BMI of each resident by 5% by 2030, the savings could repair and preserve every road in Louisiana with billions to spare. So how did we get here? I'm going to go back to those steps that I talked about a few slides ago, and hopefully that will help lead us through how we got to this example. So first of all, obesity is still my topic of interest. From there, I knew I needed a data source. Lucky for me, I got an article in my inbox from Robert Wood Johnson that gave a number for the economic impact to reducing BMI in Louisiana. And that's a really interesting, piece of information. But what does that number look like for real people, and what do people in Louisiana value that would make that number resonate with them? So in my mind, I know that people in Louisiana love to travel. We have festivals all over the state where we get to eat delicious food and listen to great music, which means that people are always in their cars. And yet in Louisiana, we have very poor roads, and we're always complaining about how bad our roads are. So knowing that I wanted to connect the economic impact of obesity to road infrastructure, I just was able to find another source that quoted the total cost of road repair in Louisiana. And then from there, I know I have the cost of obesity and I have the cost of road repair. So I simply subtracted them from each other to figure out if our obesity savings would help with the roads. And that's how we got that example. This one is actually one of my favorites because I work in schools. I use this one all the time. And this example is the estimated number of children in Louisiana under the age of 5 who are obese or overweight could fill more than 1,600 school buses. Those buses would stretch more than 11 miles if lined up end to end. That is long enough to wrap around the National Mall 5 times. So again, how did we get to that example? Obesity is still our topic of choice. It's something we talk about a lot in the health promotion team. I know that I have childhood obesity data at the state level, but I need to figure out how to translate that. And when I think of schools, I immediately think of big yellow school buses lined up around the block, picking up kids and dropping them off to go to school. So I decided to connect the two by using school buses and distance to demonstrate the scale of our childhood obesity numbers. So I'm going to lead you through the equation. This one, like I said, is a little more involved. You'll need to figure out the number of children who are obese or overweight. From there, honestly, Google is your best friend. You use Google to find out how many kids can fit in a bus and how long a bus is. And so from there, I simply divided the number of kids who are obese or overweight by the number of kids who would fit on a school bus. That gives you the number of buses that these kids would fill. That's where we got that 1,600 buses. From there, you multiply the number of buses by the length of one bus and then transform that number from feet to miles, and that gives you the distance, how far these buses would stretch lined end to end. And then from there, you need to find a distance that's impactful. The first time this equation was used, our health promotion director was in Washington, D.C., so the National Mall was a perfect landmark. But make this distance your own. Make it local. And then once you have a distance determined, you can simply divide it by the total length of all those buses, and that's going to tell you how many times those buses are going to be able to go around those distances. And we found that this social math example has been especially impactful. Now, we keep talking about this cheat sheet, and this is just a quick snapshot of what that looks like. So once we developed a couple of examples, we simply pulled them together into this cheat sheet. You've done the work, so you want to make sure those equations are easily accessed. They should be right at your fingertips if you need them for a presentation, a media request, or for whatever you use them for. We found that organizing them by topic has worked for us, but you really can format and organize your cheat sheet in whatever way works best for you.
Thanks, Kate. And now we'll tell you a little bit about how we have taken or developed social math and integrated it into our messaging. As Kate mentioned earlier, in Louisiana, we have a very rich culture and strong family traditions. However, this contributes to one of our greatest challenges in our state, creating a culture of health while maintaining value on our state's culture and traditions. So in integrating our social math, it's really important that we are aware of our audience, that we identify things and references and values that are going to resonate to non-traditional partners across the state. And once we go through some of those examples, we'll also give you some of our tips for adoption with social math messaging. This is an example of a traditional statistics slide that you'll see in a traditional health setting in a presentation. We actually worked with our Office of Public Health and Medical Directors and took some of the slides they were using in community-based presentations and converted them to social math. So this is an example of a slide that our Region 6 Central Louisiana Medical Director was typically using to identify premature death in Louisiana and what that looked like in terms of years lost. So this was the traditional data bar graph slide, and we helped him to transform to this social math slide. It was more appropriate for his audience. And here you can see that we're still communicating premature death, years of life lost, as well as a social math statement that says this is almost 8 additional years for every resident in Catahoula, which is a parish in our state, that would spend with their families, play with their pets, and spend time in their communities. This was a great way for this medical director to impact the audience members that he was speaking to, and then also to really define what those numbers that come from the data mean and how they should create non-traditional partner movement in the direction of health. Here's another example. This is the diabetes rate in Central Louisiana, a traditional data bar graph slide that was used in presentations, and this was converted to this social math equation. In Louisiana, we know casinos, and this casino is a casino that most residents in Region 6 or Central Louisiana would probably be aware of the size, and this would resonate with them. It shows that the number of adults with diabetes in this region could fill up the Paragon Casino in Marksville 35 times over. Having target audience awareness, especially for us in Louisiana, it has been very important as we've developed social math. It's most important to find out what's going to work best for the community that you are speaking to. Always remember that it needs to resonate value and also create visual impact. For Louisiana, places like a packed football stadium, a common casino, and distances between two common cities that people commute against are going to have visual impact when creating social math. Social math can be used not just for your community residents, but also for non-traditional partners in business. We've talked a lot about non-traditional partners. With our health promotion team in the Office of Public Health, we're trying to work with business and industries across the state to help them implement health in all policies and to work with us in a collective impact model to improve the health of the residents within our state. So making sure that your social math equations can be appropriate for business and industry is definitely different than for those just a regular community member attending a community health assessment or a community forum or health presentation. You want to try and gain the support and buy-in of your non-traditional partners, so you have to meet them where they are, and social math helps with that. We learn to talk about bottom line in public health and to realize that not everyone understands health or values health in the same way that we do. So it's all about finding out what comparisons are impactful for different groups and quantities that are going to resonate with communities, knowing that it is not going to be as impactful for business or industry leaders who are more concerned about productivity or the bottom line financially. So in conclusion, we have several tips for adoption that we'd like to share with you. Really important and helpful to our success with social math is to identify a person on our team who is creative, has decent math skills, and can develop that cheat sheet for you, ensuring they have easy access to your epidemiology team. Once you have that cheat sheet, make sure it includes talking points with the equations. Create a list of social math data sources and familiarize yourself with the associated numbers. Pick one issue to start with and have that designated person develop the cheat sheet within a set time frame. Be sure that you're creating value by researching what is important to your target audience. Create new guidelines for presentation development, talking point drafts, or any other public presentations, and not just for your direct team, but for as many people that you can impact or provide data to. It may be from a press standpoint, or in our case, our medical directors from the Office of Public Health. We were able to provide them with this social math cheat sheet and help them begin to communicate social math in their own presentation. And then find a way to ingrain the use of social math in your team's approach to public engagement, and try to include it every time you're engaging the community in all your health promotion efforts. So we thank you for listening to how our state has adopted social math, and at this time I believe we are going to turn it back to Patrick.
Excellent. Yes, you are, and thank you very much, Chelsea, Melissa, and Kate. That was really interesting, and love to hear what you're all doing in Louisiana. Again, you're going to have an opportunity to ask questions over the phone with all of our presenters just in a few minutes. But as you're thinking of questions, please feel free to chat them in the lower left-hand side of your screen there in the chat feature. We'll address them when we're opening up the phone lines. So now I'm going to turn it over to my colleague, Melissa Talbot, who's going to take us through the third and final session of our webinar, in which we're going to learn a little bit more about how you can integrate these social math equations into your messages and materials. So, Melissa?
Thank you, Patrick. As Patrick mentioned, we want to take a few minutes to talk about how you can apply social math to your messages and integrate it to your materials. So you may be familiar with our message framework worksheet. We recommend that you use it as a tool to develop media-savvy messages that get attention. Because, as Jean mentioned, and as we certainly saw with Louisiana's presentation, social math works by making an issue urgent and relevant to an audience. It can be very effectively woven into this framework to strengthen your messages. This is particularly true for the first two message components, in which you specify the situation in your community and then illustrate the current landscape. In the first message component, social math works well because it calls attention to the immediacy, the size, and the scope of your issue. Here's an example. The number of our children without access to safe routes to school could fill, for example, 80 school buses in our community alone. In the second message component, you might use social math to demonstrate why your issue is important in the context of your current community landscape. For instance, if we don't address our situation now, the cost to our community over the next 10 years will equal enough money to, and of course you fill in examples that will be relevant to your audience and your community there. We're attaching this message framework worksheet along with the other downloads from today's webinar. We hope you'll look at the worksheet with a fresh set of eyes and consider adding social math into your messages. Amplifying what we just heard from Louisiana, your social math equations can be shared with audiences in a number of ways, such as media releases, talking points, fact sheets and reports, social media messages, PSAs, public service announcements, videos, success stories, and infographics. As always, we want you to think strategically about your choices. Remember your communication objectives and your intended audiences. What kinds of materials are most likely to reach your audience? What is most likely to convey your message most effectively? Let's look at some examples from other DCH awardees. The University of Alabama at Birmingham set out to describe health disparities in a way that would be easily understood by any audience. In this video, you can see and hear how they translated their larger population numbers to a simple village of 100. In this way, viewers can easily see the disproportionate impact of chronic disease and other issues on African Americans. For example, if Birmingham was a village of 100, 71 people would be overweight or obese, and 58 of those people would be black. A young African American boy would have a life expectancy 5 years less than his white counterpart. You can visit the URL at the bottom of the screen to see the entire video and how the straightforward use of social math has made it much easier to understand the health challenges Birmingham faces. Another example, the Wilkes-Barre, Pennsylvania YMCA created a success story about its efforts to provide free meals to low-income children during the summer months. They used the CDC's success story application, which gave them the opportunity to identify their challenge, their solutions, and their results. You can see from the quote on the screen that Wilkes-Barre's program made it possible for a substantially greater number of low-income children to enjoy healthy meals during the summer months, and they did it with social math. In 2010, before the program was established, if you sat the children in the program at picnic tables end to end, it would roughly measure the length of one NBA basketball court. In 2012, if you sat this group down at picnic tables end to end, it would roughly measure the length of 3 NFL football fields. This shows a 746% increase in participation in just 2 years. Now let's look at a few examples of materials created by DCH awardees and taken from the Community Health Media Center. These ads, both from Choose Health LA, use visual social math to compare the number of calories to portion size. And as a note, you'll find links to these ads under each corresponding image. This print ad from the La Crosse, Wisconsin County Health Department is intended to encourage residents to eat healthy foods. It uses social math to remind us that it doesn't take much to significantly tip the scales in the course of just 1 year. Now let's look at a couple of tobacco-related examples from CDC's Media Campaign Resource Center. This print ad is part of the Piles of Packs campaign created by the State of Arkansas's Department of Health. Each ad in the campaign uses piles of cigarette packs to capture visually the overall number of cigarettes, and in this ad, linguistic social math is added to demonstrate the literal cost to smokers. Each ad in the campaign includes a quitline number to help smokers put down their cigarettes for good. In the same way that Arkansas used a visual of cigarette packs, the Minnesota Partnership for Action Against Tobacco created this powerful visual to complement the social math of the ad copy. If you smoke around your child, they can inhale the equivalent of 102 packs of cigarettes by age 5. Again, the ads on this slide and the previous slide were taken from the Media Campaign Resource Center, and links to each ad campaign is underneath the corresponding image. Finally, we want to mention that social math can be very effective in infographics. Infographics are an accurate representation of data in pictorial form to help tell the story inherent in the data. The social math is immediately visible in these two examples, both available from the CDC. On the left, in the more they burn, the better they learn, we can see how 60 minutes of activity can translate into academic success. In the new abnormal, the difference in portion size is a powerful visual social math statement. It quantifies a change over time with a context that anyone can understand. Thank you for letting us share just a few examples of success stories and materials that have integrated social math. For more inspiration, you can visit the Community Health Media Center and the Media Campaign Resource Center. And with that, I'd like to turn it back over to Patrick.
Excellent. Well, thank you very much, Melissa, and thank you to all our presenters.